Pregnancy complications. Pregnancy complications are health problems caused by the pregnancy itself. These complications can occur during pregnancy, delivery, or postpartum. Pregnancy complications range from mildly irritating to life-threatening. Let's look at the complications related to pregnancy trimesters, labor, and postpartum. First trimester. The following complications can occur at this stage. Molar pregnancy. A hydatiform mole is a pregnancy complication caused by a gross malformation of the trophoblast, which normally develops into the placenta. Molar pregnancy is caused by an abnormally fertilized egg, which can lead to hemorrhage, persistent gestational trophoblastic neoplasia, choriocarcinoma, and anesthetic risks. Ectopic pregnancy. This is the term used to describe a situation in which the fertilized ovum embeds outside the uterine cavity. The cause is unknown, but the following have been linked to an ectopic pregnancy. Prior uterine tube surgery. Diethylstilbestrol exposure in the uterus tube abnormalities at birth. Previous infections such as chlamydia, gonorrhea, and pelvic inflammatory disease. Ectopic pregnancy can cause fetal abnormalities, high fetal mortality, and infection, resulting in peritonitis and septicemia. Miscarriage. This is the spontaneous or induced death or expulsion of a fetus before 24 weeks of gestation. The cause can be chromosomal abnormalities, trophoblast malformation, excessive alcohol and coffee consumption, smoking, infections such as rubella, hysteria, chlamydia, and maternal diseases such as diabetes mellitus, renal disease, and thyroid disease. Implantation bleeding. Early pregnancy bleeding can be implantation bleeding, which is a small vaginal blood loss that occurs during implantation and usually coincides with the menstrual period, making it easily mistaken for the monthly period. Cervical erosion, polyps, cervix cancer, and miscarriage can all cause bleeding. Hyperemesis gravidarum. Excessive nausea and vomiting in pregnancy between 4 and 10 weeks requires medical intervention to avoid acidosis, dehydration, encephalopathy due to vitamin B deficiency, hepatic involvement, and death. The following events can occur during the second trimester. Cervical incompetence. This is a painless dilatation of the cervix in the second or early third trimester that allows bulging membranes to pass through the cervical os into the vagina. If the membrane ruptures, miscarriage or premature birth may occur. Placenta praevia. This is the premature separation of a normally located placenta after the 22nd week of pregnancy. The cause is unknown, but risk factors include uterine fibroid, particularly uteroplacental fibroid, as an intramural and abnormal placenta. Third trimester. Complications that can occur at this stage include preeclampsia. After 20 weeks of gestation, it is a medical condition characterized by high blood pressure, proteinuria, and pathological edema. Eclampsia, pulmonary edema, acute and chronic renal failure, and placental abruption may occur in severe cases. Preterm labor. This is the type of labor that begins before 37 weeks of pregnancy. The cause could be placental abruptio, twin pregnancy, infection, or cervical incompetence. Labor. Labor is the process by which the fetus and placenta exit the uterus. Complications that can occur at this stage include prolonged labor, which can result in maternal exhaustion, fetal distress, and perineal tears. Other complications, such as perinatal asphyxia, a condition caused by a lack of oxygen to a newborn infant that lasts long enough during the birth process to cause physical harm, usually affect the brain. Shoulder dystocia. A condition that occurs when one or both of the baby's shoulders become stuck during vaginal delivery. Other complications include excessive bleeding, placenta praevia, cephalopelvic disproportion, uterine rupture, and umbilical cord prolapse. Finally, postpartum complications. The postpartum period begins after the birth of a newborn baby. During this time, the following events may occur. Amniotic fluid embolism. A rare but serious condition that occurs when the fluid that surrounds the baby in the uterus during pregnancy or potentially fetal material enters the mother's bloodstream. Postpartum depression and infection or sepsis. Thank you for your time. Make sure to subscribe for more if you enjoyed this video.